Hello, great to be here with Katie Maloney from DeciBio. We are here to talk a little bit about spatial biology. Katie, you've been in the space for the last at least 5 years that I know of. So tell us a little bit about how this space is evolving.
I've followed the space for the past 6+ years, and the conversations have definitely changed. I think it went from being a very investigational, how should we be using this, to especially like it's coming clear at AACR this week that there's a lot of activity, a lot of the interest. I think this week has been around the spatial biology space. There's been some great presentations, a lot of companies that are developing their product portfolios in the space. Growing interest in understanding how the insights can be translated from basic research into translational and eventually into clinical. And I think you guys had some interesting data kind of showing the deplexing capabilities, which is something that I think resonates well because there's a need to bridge that. You can't bring the 1000-plex to the clinic, but you also need the insights that are derived in that basic research space. So yeah, we've seen a lot of that. We continue to see that.
Yeah, absolutely. And one of the things you do is track adoption. Over the years, DeciBio has come up with some great reports on clinical trials and where spatial biology or spatial biomarkers are being used. Are you seeing an increase in adoption at the moment?
Yeah, definitely. We just published our recent updated spatial biology report, and the market's continuing to grow. It's continuing to grow across phases of development, but it's driven by increasing adoption and across multiple platforms. There's a lot of data being generated, and I think this is another interesting place where you play, where a barrier has been the sheer quantity of data that's generated is hard to analyze. And for a long time, it was limiting the pace at which experiments could be run. And I think there's increasing availability of tools to help analyze that data, which is essential in order to drive further adoption.
And on that note, we try to expose the mechanism of action in phase 1 nowadays, and that's kind of become the way we work with pharma companies, where we don't wait till phase 3 for the pharma company's clinical trial to fail. We try to get to the mechanistic underpinnings of cancer and how it interacts with the therapy in phase 1. Are you seeing a shift in terms of people doing it early, the multiplexing, the exposition of the network biology early in clinical trials?
Yeah, I think there is an interest in understanding those things earlier in development. I think you are mindful of the sample size of the trials you're working with, and you don't need 500 patients to be able to do that. And so the size of a phase 1 trial works well. I think there are still, questions around budget availability and how does that play out across phases of development, and the resources they have to go to there's a lot of questions being asked, right? Like spatial is a big piece of it. There's questions on the proteomic side of things and the single cell side of things. And so I think we're increasingly understanding that spatial is an integral part of that.
Sure.
And understanding the balance between bringing all this data together. There's multi-omic data sets that are being created and driving.
Absolutely. And there's agentic AI, and now you have a lot of people talking about foundational models with AI. So what are you seeing in terms of evolution of AI and clinical trials and spatial biology?
I think there's a lot of promise. I think there's a lot of conversation around it right now. I think that these are terms that we and the layperson is familiar with now to an extent they weren't familiar with a year ago. What is an LLM? What is agentic AI? And because of that, it changes the conversation a little bit and allows us to drive forward faster than we could prior to the availability of these tools. I think there's a lot of promise there. I think there's also a lot of barriers with regards to, what does the regulatory pathways look like here? How do you actually commercially deploy these tools? But they're really powerful research tools. And I think we're just beginning to scratch the surface of the insights that we'll be deriving from them.
Thank you very much, Katie. Really appreciate it.
Yeah, absolutely. Thank you.